give this talk. So let's start about the CPR. So CPR, an emergency procedure in dental clinics, private dental clinics, or in our, not only in dental clinics, even when we go out, we see some people, known people or unknown people, going for cardiac emergencies. So as a dental surgeon, as a dental professionals, we should be aware, or we should be having the knowledge of how to deal with such concerns, such victims. So life-threatening situation may also occur anywhere within the dental office or anywhere outside also. So medical emergencies have occurred in the waiting room, restroom, laboratory, dental office, and treatment room. So sometimes death of course is inevitable, but sudden death is preventable in many occasions. So what is clinical death? Clinically, the death occurs at the moment of cardiopulmonary arrest and can be reversed if recognized promptly and effectively. That is main important. So clinical death can be prevented or avoided if we promptly attend the patient in time. That's very important. Then what is biological death? The clinical death follows the biological death if unattended because of the cellular damage, permanent cellular damage due to lack of oxygen. That's very important. So the biological or cellular death of neuronal brain tissue takes place when there is inadequate or no supply of oxygen for more than 6 minutes. That's very important. So always there should be regular supply of oxygen to the brain. So ultimately the brain is the main thing which has to be resuscitated. It is the cerebrum.
You can take some pictures, huh? Just click on it.
Sudden death. So sudden death, that is most commonly we call it sudden death as cardiac arrest. Sudden death occurring within 1 hour of the onset of signs and symptoms. So instantaneous death is within 30 seconds, which we can't do anything. So some people, they have some silent killers. We call it as cardiac problems as silent killers. Some people we can't do anything, so they will not be having any clinical signs and symptoms, but suddenly they will go for death, which we cannot do anything. But sudden death, which can occur within 1 hour on the onset of signs and symptoms, we can prevent that and we can save the patient, save the victim. The cardiopulmonary collapse, also called as cardiac arrest or sudden death. So what are the reasons? So not every cardiac patient can be resuscitated, but if you provide CPR, defibrillation and post-resuscitation care, that is hospital care or advanced care, we can increase the rate of survival. So in the dental clinics, we are getting many patients who may be having some dental problems, along with that some medical problems, especially cardiac problems. So we should know how to deal with such patients. So life-threatening situations may occur anywhere in the dental office. So in all the situations, the unconscious victim must be replaced or placed in the supine position so that we can deliver the basic life support in time. So the concept is why do we give chest compressions on the thing? Because heart lies between the two moaning masses, the sternum located anteriorly and the spinal column located posteriorly. So with compressions of the sternum toward the spinal column, the intrathoracic pressure is raised. When you compress the sternum, the intrathoracic pressure is raised, and compressing the heart, intrathoracic pressure is raised, compressing the heart and the blood vessels and producing a cardiac output. When you compress the thorax, there is an increase in positive intrathoracic pressure, which increases the cardiac output. In the dental office, if the victim is lying on a soft surface, that is soft cushion and comfortable dental chair, the spinal column flexes and the force of the compression is partially absorbed by the soft surface, thereby lessening the effectiveness of CPR, external compression, chest compression. So what we have to do? So preferably, if possible, we can give a hard object. It is frequently recommended that the cardiac arrest victim be removed from the dental chair. It's better to remove the patient from the dental chair and place on the floor so that the basic life support can be performed more effectively. But in many clinics, the space is the main problem and the lack of the attendants. So in most clinics, little or no floor room is available. So in such situation, it is difficult or impossible to move the victim to the floor. So what we can do? So we can keep a hard object just back of the patient, put the chair on the patient back, and we can start doing compressions. So under no circumstances, BLS should be withheld or delayed just because of the inability to move the victim to a more suitable position. So better you can do a CPR even if it is bad. So bad CPR is at least better than the no CPR. So always you should know what to do. I mean, you should do at least CPR even if the situation is not proper. So what is CPR? So cardiopulmonary. Similar to cardiopulmonary, heart and the lungs. So cardiopulmonary, something related with circulation and ventilation. Both are very needed, very much essential. Circulation as well as the ventilation with oxygen. So cardiopulmonary resuscitation refers to the steps taken to revive and return from the cardiopulmonary collapse, cardiac arrest, and prevent cerebral anoxia. That is very important. And to prevent cerebral anoxia by increasing the circulation and ventilation. So what is cerebral resuscitation? So we have to resuscitate the brain. Brain needs continuous blood supply, especially continuous supply of oxygen. So brain cannot survive without oxygen more than 6 minutes. So that is very important. So even we call it as CPR, it should be called as CPCR, that is cardiopulmonary cerebral resuscitation. It is the most important goal in saving a life in cardiac arrest. So return of the victim to pre-arrest level of neurologic functioning, that's very important, is the ultimate goal of emergency cardiac care. So Dr. Safar and Bircher from the University of Pittsburgh has termed the term CPCR, that is cardiopulmonary cerebral resuscitation. So CPR is having a history of 50 years, more than 50 years, but there is a periodic changes in the guidelines which has improved to increase the rate of survival rate. The purpose of CPR, why do we have to do CPR? So it is unlikely to restart the heart. It never restarts the heart, but it helps to increase the blood flow and the oxygen flow. So, but rather its purpose is to maintain the flow of oxygenated blood to the brain and heart, thereby delaying tissue death. So we just delay this tissue death until the emergency team arrives. That is the main concept of CPR. We are not going to restart the heart, but we help to delay the tissue death by providing CPR chest compression so that there is a blood flow and oxygen supply is there to the brain. So defibrillation and advanced cardiac life support are usually needed to restart the heart. So what is CPR? It is a combination of rescue breathing and chest compressions. So rescue breathing, which provides oxygen to the person's lungs, and chest compressions, which keeps the person's blood circulating. So indications for CPR, very important thing. So patient could be going unconscious in front of you, or loss of consciousness, witnessed or unwitnessed, and no respirations or brief, irregular or gasping breaths, no pulse. Most commonly, unconsciousness and no pulse, we have to immediately start CPR. So these problems are present in conditions such as cardiac arrest, suffocation, choking, drowning, electrocution, drug overdose. As a dental surgeon, we will come across such patients like cardiac arrest patients, choking, aspirating of any dental materials or tooths, which causes choking, and drug overdosage. Overdosage because of local anesthesia, all these things can result in cardiac arrest, which will result in cardiopulmonary collapse. So what we have to do is, it is an emergency procedure, but it does not require any preparation. It is just an emergency procedure, but it does not require any technical preparations. What to do in an emergency? First, we should emphasize what not to do. Do not leave the victim alone and do not get panic. Do not try to make the victim drink water, and do not throw the victim water on the victim's face. Do not prompt the victim in sitting position, and do not try to relieve the victim by slapping on his face. So what to do? So the technique is called as basic life support. So basic life support refers to a series of steps taken to enhance the chances of survival of an individual during a medical emergency. So the basic life support includes the emergency CPR includes the basic life support, that is called as basic cardiac life support, which includes the CPR, that is airway breathing and circulation, and then the emergency medical service, that is the defibrillation, and shifting the patient if needed to advanced cardiac life support to a hospital setup. These three are the main important thing for the revival of the patient. So chain of survival. So the chain of survival is mainly the yearly access to the patient, yearly access to the hospital, yearly CPR, yearly defibrillation, and yearly advanced care. These things are very, very important for the success of the survival of the patient. New CPR guidelines. There's a periodic changes in the guidelines. So what are the new CPR guidelines? So in 2010, American Heart Association has recommended some new guidelines. So normally in our schools, in our school of dental school, we have studied that the treatment plan, the guidelines are ABC, airway, breathing, circulation. But now it is changed. So the first step is doing chest compression instead of first establishing the airway. These guidelines apply to adults, children, and infants, but exclude the newborns. That is, we have to first start with the compressions. This is not ABC. The old way was airway, breathing, circulation, but now it is compressions, airway, and breathing, not ABC. Why? So compressions. Why rearrange? The old approach was causing delay in chest compressions. So we assess the patient, we check for the airway, then we give breathe, then we come to chest compressions. By the time you are losing minimum a minute. So you are delaying the compressions. So ultimately you have to start with the compressions without delaying. Without delaying, you have to immediately start. So by starting with chest compressions, many victims' life can be saved. So oxygen. So where will you go for oxygen? So there will be a question. So without breathing, without oxygen supply, how can you compress? But there is some amount of residual volume of air present in the patient's lungs and the body. So good chest compressions really help save lives. How? In many cases, there is a reserve of oxygen left in the patient's blood and lungs from the last breath. And we can take advantage of that reserve just to do chest compressions. So how does CPR cause blood flow? So when we do a chest compression, there is a compression of the chest which increases the thoracic pressure. We call it as positive thoracic pressure. When you compress it, there's an increase in pressure or intrathoracic pressure, which is called as positive intrathoracic pressure. When there is an increase in pressure, the diameter decreases and the pressure increases. Because of that, the blood moves out to the least resistance areas. And when we just recoil it without leaving the hand, taking the hand out, there's a recoil of the chest causing a negative intrathoracic pressure. When there's a negative intrathoracic pressure, it just sucks the blood. Not only the blood, the oxygen also. So there is compression. Because of compression, there is delivery of blood, that is oxygenated blood. When there's a recoil of the chest, there is sucking of blood along with oxygen. So it is a common misconception that chest compressions circulate blood by squeezing the heart. This is not correct. So blood flow during chest compressions primarily occurs because of changes in intrathoracic pressure. As I said, when we compress it, there is a positive intrathoracic pressure. Because of that, there is increase in blood flow, and diameter of the chest wall is decreasing. So, yeah. So ensure that the total there should be some total chest recoil, so that there is negative pressure created. Because of that, the blood is sucked inside. The most important factor is the CPR is bringing the coronary pressure, coronary perfusion pressure. When we do cardiac chest compression, it increases the intrathoracic pressure, thereby increases the coronary perfusion pressure. When the heart itself has to get more blood, when the heart itself is getting more blood by the coronary perfusion pressure, the heart tries to increase its cardiac output. Survival rate is related more with chest compressions, where there is a improved or increased coronary perfusion pressure. If the chest compression is good and if the coronary perfusion pressure is increased, then the survival is good. And of course, the depth of compressions, how much we have to compress, that is very important. So normally, in older concepts, it is 1.5 to 2 inches. So if you are doing compressions more than 2 inches, the survival rate is very good. Okay? So the depth of compression is related to the rate of survival. Similarly, if the compression is good, the depth of compression is very good, the success of a defibrillation shock is much higher. So it is all related to chest compressions. Chest compression is very, very important. So how to do the new CPR? Just a rough outline I'll give now. So first thing, you just activate the emergency medical service. So call 999 and call for an AED if you are seeing the patient. Try to see the patient and try to get the patient's responsiveness. If the patient is not responding, check for the breathing and check for pulse. If there is no pulse, no responsiveness, you should start chest compressions. Welcome to you again. before you start any rescue efforts, you must remember to check the victim for responsiveness. Mostly in the dental clinics, it will not be a problem because we will be seeing the patient. So the minute the patient goes for unconsciousness, we will be able to revive the patient. So it's not a problem. Maybe in the waiting room, the patient may go for unconsciousness, then we will not be noticing it. So that is the problem. So always, whenever you see the patient who is undergoing unconsciousness, or already unconscious, so you have to check for responsiveness. So tap and shout at the patient and check for responsiveness. And if you suspect any neck injury, that is out of the clinic in the roadside, if you suspect any spinal or neck injury, don't shake the patient. Support the neck, and if the victim is known to you, you can call him by the name. Don't, if possible, you can give a neck collar to support the neck area. So adult CPR. First we'll start with adult CPR. The CPR is similar, almost similar for adult and children, but different for infants. So what is adult CPR? So one rescuer. So determine the responsiveness. So just check for the responsiveness, whether the patient is having response or not. If no response, check for breathing. So you should do this within 5 to 10 seconds. Check for breathing. So you go close to the patient head, patient's nose, and observe that. Look, listen, feel. So you keep your face close to the patient's nose and see whether any air is gushing out or not. You feel you are getting hearing any sound or not, and any feeling on the chest, and any chest expansion or not. So you should do this, all these three things simultaneously. You should look, listen, and feel for the air. That's very important. If there is no breathing, all these things should be done simultaneously within 5 to 10 seconds. So if there is no breathing, you can activate the emergency. If suppose nobody is there, you are alone, you cannot activate the emergency, you better start. Check for the carotid. Next step is check for carotid pulse, and if there is no pulse, go for CPR. Then you check the carotid pulse. In the neck, just from the midline, you locate the trachea, and from there you bring down your fingers laterally and medial to the sternocleidomastoid muscle. You feel the carotid pulse. So even in feeble patients, you can feel carotid pulse. Even if the carotid pulse is not, you are not able to feel the carotid pulse, then immediately you will start CPR. If there is no detectable pulse, start chest compressions at the center of the chest, at the nipple line, with the heel of one hand on top of the other at a ratio of 30:2. 30 compressions and 2 rescue breaths. So 30 compressions should be delivered within 18 seconds, less than 18 seconds, at a rate of 100 compressions per minute. And when you are giving 2 breaths, each breath should be delivered for a period of 1 second, so that the chest recoils completely, chest expands completely. One cycle is 30 compressions and 2 breaths. The rule is push hard and push fast. That's very, very important. You should push hard and push fast.